Natural Calm by Natural Vitality is the solution to both restoring a healthy magnesium level and balancing your calcium intake, the result of which is natural stress relief. With flavors like raspberry lemon, all you've got to do is mix it into your water, drink it, and you'll feel better. Check it out at naturalvitality.com. Hi, I'm Lisa Davis, and I'm so glad to have Dr. Deepak Kapoor on the program from New York City. We're going to be talking about kidney stones. Apparently, I did not realize this, but 1 in every 10 Americans will suffer this year from kidney stones. That is a lot. Thank goodness we've got Dr. Kapoor here to help us out. Hello, Dr. Kapoor. Welcome to It's Your Health.
And thank you, Lisa, for inviting me to participate in the program. I'm looking forward to the discussion.
Oh, so am I. I really don't know that much about kidney stones. I don't know people. We've all heard of them. I had a friend who spoke about having them and that they were very painful. What are kidney stones and why are they so common?
Well, kidney stones, in its simplest terms, are the result of overly saturated urine. Urine, as we know, cleanses the body of certain waste products, and these waste products are dissolved in water. And the most significant component of urine is, in fact, water, with a variety of other metabolic waste products that are put into it. So when the concentration of those waste products is too high, they crystallize. And the analogy I give to my patients is that if you're mixing up some lemonade or iced tea and you're not paying too much attention and you keep putting the mix in, eventually the mix settles out at the bottom, So it's a similar concept to that. So you can form this overly saturated urine by one of two fundamental mechanisms. The first one is you can have too much of the chemicals, too much of the waste product excreted in the urine, or number two, you can have too little urinary volume to dissolve whatever waste products that you're producing. Often, kidney stones are in fact a combination of both factors, that you're overly excreting certain metabolic products and simultaneously you're not drinking enough water to exclude them. Now, as we know, in all of our busy lives, virtually nobody hydrates the way they should. Lisa, most people don't remember that our bodies are 75% water. And we lose water all the time. We think about just excreting it in urine, but you lose it in your sweat, you lose it in your breath, you lose it in your stool. For women, they lose it in their menses. So your body is constantly radiating water out to the environment. And we need to constantly replenish that water supply. Otherwise, our urine becomes overly concentrated. And the end product of that overconcentration is the crystallization of these metabolic products into stones.
All right. So my question is, how do you know if you're a person that happens to be in the first category that you mentioned, where this is your body doing it, and perhaps you are drinking enough water? Would that still be happening? Am I making sense?
No, I understand what you mean. So the question is, how do you know if your chemical balance is abnormal? And the short answer is you don't. There's really no way to tell other than by measuring the components of your urine. You can have a pretty good idea of whether or not you're drinking enough water. A very crude test is just look at the color of your urine. If it has a very concentrated odor, or if it looks very dark yellow or amber, then you're probably not drinking enough. If you're well hydrated, urine is very pale straw-colored, almost getting to clear. And if it's much yellower than that, then generally your urine is overconcentrated. Now, I will tell you, there are certain medications and vitamins and foods that can discolor urine, so that's not an absolute 100% guaranteed rule, but it is a pretty good rule of thumb.
Oh, yes. Okay, that makes sense. Yeah, I mean, I just drank a huge glass of water. I'm one of those people, doctor. I'm constantly having to go to the bathroom, and it drives me nuts. So I used to not drink enough water, but then I was still always going to the bathroom, but it was just more concentrated. So I'm like, well, if I'm going to go, I might as well have a lot to go. I don't know why.
Lisa, this urinary frequency sounds like the topic of another show, because we can definitely help you with that.
Oh, please. It's been my life's, the bane of my existence. Seriously, ever since I was a kid, I was just like, I always have to pee.
There are a variety of things that urologists can do,
Oh,
and we can digress and talk about urinary frequency. But as far as the kidney stones
yes.
are concerned, the problem is that there's multiple different kinds of kidney stones. We can talk. There's calcium stones, uric acid stones, infection stones, cystine stones, and there's a whole variety of different foods that can relate to that. Now, it's interesting. A lot of people believe that if you have diets that are very high in dairy products, that results in increased stone formation, eating a lot of calcium. In reality, there are certain types of there's only certain types of stones that are related to increased calcium load from food. Most types of stones are not really related to the calcium that you eat. So, and the other problem, Lisa, is that you can peacefully coexist with a kidney stone for many, many years. Many people are under the misapprehension that kidney stone pain is the result of the stone directly irritating the body. And when you see a kidney stone, they are like little stones. They're like little pebbles that you can find on the street. They really can be that hard. And so people think, well, the stone is just rattling around there or rubbing up against my insides, and that's what hurts. That's not the case, Lisa. The reason why people have stones is the stone pain is obstruction to the flow of urine. So if you have a stone that's in place and it's not obstructing the flow of urine, you will not even know it's there. I mean, you may get other symptoms like blood in the urine or an infection or other things, but you may not necessarily have pain. So the simple fact is people can peacefully coexist with stones for many years and then seemingly out of the blue have this excruciating pain and have no idea from where it came. And the problem is that we can analyze the patient at the moment in time that they're having pain, but they may have formed that stone a year ago. And whatever the condition was that resulted in the stone a year ago may not actually be present at that time. So, what I'm driving at is that the important thing for patients with stones is that they have ongoing follow-up. You have to see your doctor regularly because, the statistics show that if you make one stone, there's a 90% chance that over the course of your life, you're going to make more stones.
Now, even if you up your water intake to a really high degree?
No, that was a great point. However, if you see a urologist and we institute some changes, which is either if the problem is lack of hydration, if we hydrate you, if the problem is a metabolic problem, and if we adjust the metabolic situation, we can reduce that 90% stone recurrence rate down to 10%. So that 90% is for people that have one stone and then really don't do any follow-up about it. But we can bring that down substantially with regular follow-up.
Oh, okay. See, that's good to know because, I tell you, my heart went out to my friend Larry, and he's very open about it. He was in agony. I mean, the way he described it made it sound worse than when I, gave labor or had labor, had a child. He said it was just insane, just an intractable pain, like you said, just awful.
Yeah. Most women that have had babies and had kidney stones say that labor can be less intense than stone pain. So,
that's horrendous.
And the only difference with a kidney stone is that you don't have 18 years of child rearing and then college tuition afterwards. So in some ways, stone pain hurts a little less.
Yeah. You have a great sense of humor. So it sounds like the takeaway is we really need to be on top of these things. Now, they can be asymptomatic, which is a problem, and then all of a sudden you're in agony. So it sounds pretty tricky to even know if you have a stone. I mean, I think that happened to my friend. He's just going along, and all of a sudden he's like on the floor writhing in pain. I mean, is that the way it usually occurs?
Unfortunately, yeah.
Oh, boy.
That is precisely the way it works. Because, and kidney stone pain, there's virtually nothing that replicates it, and that type of pain, when you have a obstruction to the flow, we call that type of pain colic. And colic is a very intermittent, extremely, extremely intense pain because the kidney, the urinary bladder. You mentioned your tiny bladder, but the urinary bladder is an organ that's designed to distend. So it's designed to fill with urine. The kidney is not a distensible organ. the ureter tubes that drain urine from the kidneys to the bladder are not distensible organs. When these organs are obstructed and they swell, the pain is absolutely excruciating. But the problem is that the kidneys and the ureters, they don't have pain sensors the way that other parts of the body do. So you can experience pain in the flank, you can experience pain in the abdomen, the pain can shoot down into the groin. Sometimes it can actually be referred to the thighs and into the genitals. So we have people come in, women complaining of vaginal pain or men with testicular pain, and it's actually a kidney stone. So it's important when you have this type, but when you get the type of pain that goes from 0 to 100 virtually instantaneously, the first thing that pops into our head is renal colic or kidney stone pain.
Dr. Kapoor, talk to us a little bit about treatments.
There was a time, and I won't tell you when I trained, but when I was a resident, most of the kidney stones that we treated, we had to treat with open surgery. That was very debilitating, and sometimes the post-op recovery was as bad as the stones. We've now developed very sophisticated fiber optic technology where we can actually look into the urinary tract with a very tiny scope that's less than about 1/8 of an inch in diameter, and actually look right into the ureter and the bladder, and utilizing a laser and a variety of other things, we can break up those stones. We also have non-invasive procedures. We call it extracorporeal shockwave lithotripsy, and that alphabet soup shortens to ESWL or SWAL. So with ESWL, we can actually break up a stone using sound waves completely without opening the body at all, and take a large stone or an obstructing stone and fragment it into sand that can pass painlessly. But the thing to remember, though, is the majority of stones, the smaller stones, will in fact pass spontaneously. And we try to allow stones to pass on their own if we can, but in situations where the pain is not manageable, or if there's a very large stone, or if there's any evidence of infection, we need to intervene. And the final thing I'll say regarding treatment is, if there is, for the most part, kidney stones are a relatively benign process because, although sometimes people with kidney stones wish they were dead, stone pain, doesn't kill people.
Sure.
However, Lisa, in certain circumstances, when there is the presence of an infection at the same time as a kidney stone, even for young, healthy people, that situation can deteriorate very, very rapidly. So a very important point is that if you're having the type of pain that is associated with colic, or if you know you're passing passing kidney stones, and you have a fever, it's critically important that they talk to their urologist immediately, because an infection with an obstructing stone can deteriorate to a life-threatening problem very, very quickly. So that's extremely a point I really wanted to bring out.
Oh, I'm so glad you did. Yeah. Again, you are absolutely fantastic. Tell us all the ways, Dr. Kapoor, we could learn about you and the work that you do and about kidney stones in general. And then I'd love to have you back often to talk about these urinary issues.
I manage a group called Advanced Urology Centers of New York. We're the largest urology practice in the United States. We have about 100 practitioners in 50 offices in 8 counties in the greater New York metropolitan area. So for people that are local to New York, one of our doctors is within minutes of pretty much anybody in the greater New York metropolitan area. But information on stones and other diseases can be found on our website. That's www.aucofny.com.
Or I look forward to having you back.
You're listening to It's Your Health Radio.